ago with the full council, and I'll just continue that. Yeah. So it's good that we can do it this way, although we don't have that direct personal interaction. Right. The discussion with the council today is on response, recovery and resilient communities. And I'm delighted to be joined by the council's leader, Dinah Romero, and also Dr. Bruce Laurence. So you're both most welcome to our forum here. Bruce, for those who don't know or who do not know, is the Director of Public Health. And they will be facilitating the discussion. It's fair to say that over the last 4 months, life has been very different for all of us. And no one could have predicted the extent to which life, in fact, has changed. And indeed, our own lives have changed. From my own experience, well, I've been busy with the food bank, and the food bank has been extremely busy. Just one little nugget: in April of this year, compared with April of last year, in the southwest, there was an increase of 124% in demand. That was the southwest average. Keynsham, we had an increase in demand of 551%. So you know, it's been hard work for the volunteers, but they've done extremely well. We've seen some remarkably brave people, from our NHS staff to shop workers, delivery drivers, council staff, all of the sort of people that are out there basically giving us a good quality of life, and continuing to do that for us, and we should be very grateful. I'm really pleased that we can host this discussion tonight to look at some of these issues, and get hopefully views and opinions from across the screen, and hopefully that will be of help. Now, before I hand over to Dean, I can't even pronounce Dina. Yeah, sorry, Dina. Normally I don't have that problem, do I? It's just that I'm trying to be quite sort of respectful. There are a few rules, as we all know, for, well, those of us, and I'm sure there can't be very many who haven't had a Zoom meeting in the last month or two. We're going to ensure that your microphones are muted. It's very important that we don't get a lot of background noise into the picture, please. Also, if you could wait your turn to speak, and only one person to speak at any time, and not to speak over others, so that we can all have the benefit of whoever has the floor at this time. Welcome to Heidi and a lady whose name I don't have at the bottom of the screen, but you are most welcome. You've got a very nice picture behind you, just over your left shoulder, just to identify you. The lady who's just taken her hand away from her chin, so you're most welcome. And then if you wish to ask a question, for those of us familiar with Zoom and those not, if you look at the bottom of your screen, you should see an array of buttons. And one of those is chat. And if you use that, you can just put a little message onto a bubble, MIS, may I speak, and send that. And Mark will be looking at that. But equally, the two facilitators, when we get going, will be the people who will be selecting those who are going to speak. So I don't think there is much more. So Dina, it's all yours.
Sorry, Alan and Dina, sorry, before you start, I just wanted to say that we are recording this meeting because it will be posted up on YouTube. So just to let people know that. And
we also didn't do the evacuation, but there's about 15 to 20 alternatives, so you'll know where your nearest store is. So all yours, Dina.
Thank you, Chair. So as Sarah was just said, so this is actually going to be put onto the Bath and North of Somerset Council's YouTube channel. So you'll be able to either re-look at it yourselves or share it with your friends and others in your community as well. What we wanted to do today is really just have a chat with you about how the pandemic has been for you and your communities, and then ask you some more specific questions which really sort of reflect on, you know, how the community has worked together and the support that it has been able to give, and maybe even think about what might happen if there's a second wave. But what I wanted to do first of all was to ask Dr. Bruce Laurence, who is our Director of Public Health, if he could give a bit of a summary of where we are now, the measures that we've got in place, you know, particularly around any potential more local outbreaks. Over to you, Bruce.
Okay, thank you, and nice to speak to you all, although virtually. So where are we now? Well, you've probably been following this about as closely as I have. You'll know that Britain and England hasn't done spectacularly well. We've been one of the world's leaders in cases and deaths from COVID, but the Southwest, at least, has consistently done rather better than the rest of the country for many reasons, rurality being one, relative wealth being another perhaps, and we've had about half the cases and half the deaths, but that doesn't mean we've got away with nothing by any means. We've had 90 deaths in Bath, North East Somerset, and over half of those have been in care homes, and all of you will know either from personal experience or just from the media that care homes and the very elderly have really taken a hit, and to some extent to protect the health service, and to some extent because old people are most vulnerable. We've had about 340 confirmed cases in Baines in total. That's the kind of tip of an iceberg, but even if we multiply that up by 10 maybe, and we have had a few thousand cases, that still means that way over 90% of people in the area have not been infected and will have no immunity, even if being infected gives immunity, and we don't actually know that yet. It's very likely there's some immunity. So in a good place relatively. Now we probably have only a handful, literally, maybe a couple of tens of people in the whole of the Baines area actively with the virus. That's all the good side. The problem is that we're easing lockdown. It's not a problem, it's what we want to do. We're getting some of our lives back, but that brings risk, and every time we ease it, so the risk goes up. None of the experts think there's a chance we'll actually get rid of this virus completely now. Probably even if we have the vaccine, we'll be with it for the rest of all of our lives. So even though we have few cases, it is there, it is ready to come back. And we don't know how it will behave in the winter. We haven't seen it through a whole year anywhere in the world, obviously. We don't know how it will interact with flu and other winter infections. So we're in this place where we want to maintain a bit of the freedoms that we're getting now, obviously, for lots of social, economic reasons, just because we don't want to be under lockdown. But I always say we are on a knife edge. If we're not really careful, we will get more cases. Well, we will get more cases anyway as we ease lockdown. That's a given. But if we're not careful, those could become significant numbers, and we could get significant outbreaks. So the task we all have collectively is to make sure we don't go backwards, make sure we control transmission. And I'd say there are sort of two pillars to that. And one is that if we do get any cases, we quickly can test, we quickly can trace contacts, and we can quickly isolate people. And that depends on these big systems that are being set up nationally. And that depends on our local coordination of that work as well. And that's where I and my team have a role. Although we're not the big players in this, we're local intelligence, we're local coordination and local support. And the community part of that work is helping people who have to self-isolate or who are struggling through COVID. And I know that in Keynsham, as elsewhere, lots of great community work has been done. And we also, through Virgin and many third sector partners, we've also had a central support mechanism for that. So that's one part of it. The other part that is, again, a major thing for local community leadership and difficult is to try to get people to maintain distancing, to be cautious, to be prudent, to do all the things that will prevent outbreaks and infections in the first place. And that's kind of difficult. And you'll see some people are very careful naturally. Some people are very, compliant. Others just don't give a toss really, do they? They'll do what they want. And between all of that, the more we can move it towards the former, the better we'll be. So again, that's where you come in. So as part of the forward planning, we're producing something called local outbreak management plans. And I can go into the details of that, but basically it is doing those two things. It's making sure we can respond to outbreaks, and it's communicating with the public, with everyone, to try to keep people being cautious. And I chair the board, it's called the COVID Health Protection Board, that helps with that first part of it, dealing with outbreaks, dealing with cases, prevention. And the board that Dina chairs, the Stakeholder Engagement Board, that has a major role to play that as the public facing, as the communications arm of this effort. So that's probably all I will say for starters, except to, thank you for work that you as community leaders have done up till now. Ask you to continue that and enlist your support and offer my support going forward into the autumn and the winter, when we there is uncertainty, and we will see what will happen. I think that's all for me for the moment. I'm happy to answer other questions as we go through the discussion.
Thank you, Bruce. So I'll ask if anyone's got any questions on what Bruce has said so far. Perhaps while I'm waiting for any hands to go up, I'll also just sort of spell out one thing. This is a bit of an ask of you as representatives from your communities. But if there is a local outbreak, I hope I will be able to rely on your support in order to get those messages out to to individuals, to make sure that everybody knows fully what to do, and possibly even more important, what not to do if there is a local outbreak. So I saw Adrian first, so I'm going with Adrian, and then I will ask, there was a hand, I saw a hand, let me see who else. Now you see, I saw Adrian's hand first, but Adrian then has later put, so I'm going with Adrian and then Duncan.
Thanks, Dina. Bruce, I was just wondering, the levels of chance of infection, even across Bath and North East Somerset, is not going to be consistent across the whole of the piece, is it? And I'm thinking particularly of areas like Keynsham, where the commute would be into the bigger areas, like into Bristol, for instance, and maybe parts of the Chew Valley as well, I guess. And I suppose, is the risk of infection any greater in areas like that, where there's no areas of commute, than there would be in some of the more rural areas of Bath and North East Somerset?
It's quite variable. Generally, the bigger numbers of cases are where people are concentrated and in the city areas, and generally we have lower rates in the rural areas. But we've seen, for example, Cumbria, quite a rural area, has quite a high rate. And then the cities of the southwest, like Bristol, I can't remember exactly, but it's sort of, out of 150 local authorities, its rate is in the bottom 15, let's say, or maybe even 10, and Plymouth is quite low. So there is some, I suppose that the perfect storm is a big city which has a lot of poverty, a lot of people who have to be very out there, live in cramped conditions, And as you get more affluent and rural, you're probably less likely. If I look at the spread around Baines, there aren't enough cases to say a huge amount about the pattern, but it broadly follows the population. There's more in Bath than anywhere, then scattering in Keynsham, in Summer Valley, and then a real handful in the Chew Valley. So yes, you're sort of right, but there are other factors, not all that we fully understand in that as well.
Thank you, Bruce, and thank you for your question, Adrian. Duncan.
A quick question to Bruce. The mobile testing unit at Odddown, did you get to receive the results? And if you did they show any interesting patterns? Thank you.
We did. Now, I don't study every bit of every number. I've got the information people and the testing people looking in detail, but I know two things I can say is it was the best used of the mobile testing units in the southwest. A few hundred people at least, I can't remember, but I heard a figure around 300. I think virtually everyone was negative. I think possibly everyone was negative. We have only had such a small number of cases in the last few weeks, 3 or 4. So that's not surprising. And then the benefit of that was that all of those people who were negative, if there was a reason why they were being tested about being a contact, they were able to go back to work. So, it was a useful exercise. And because it was well used, we want to see it, we will try to support it in the future. But certainly, overwhelmingly, if not, I think completely, everyone who tested was negative. And it was at least 300. It was well used.
Thank you, Bruce. That's actually really quite reassuring. Andy, I see you had your hand up.
I did. Well spotted, Lena. Bruce, you said in your introduction that Britain didn't exactly cover itself in glory with the pandemic. Being top of that particular league is not ideal. It's better to be in the Baines position of being bottom of the league. So I was wondering, with the benefit of hindsight, what should we have done differently to make it better, and what can we learn from the mistakes, if they were mistakes, of the past, if a second spike comes along in the autumn, which I think most of us expect?
It's hard to know exactly what happened. I mean, clearly, you have to remember the way it developed. If we had shut down a bit earlier, we would have had fewer cases. It seemed like from the very detailed genetics, we had the infection came into Britain over 1,000 times. People coming mostly from Europe, actually, Spain and France and Italy. So we had a lot of seeding at the same time because of the travel and the ski season. So that was one of the issues. I think all the things that we have in place now, I mean, we needed to set up much more large scale and rapid testing and tracing capacity. All we had was the very small capacity in Public Health England, and Public Health England was never set up to work on this scale. We've had to build that up. So I think we also made some, probably what we will see as mistakes. There was an obsession, correctly you could say, in protecting the NHS. Remember what scenes we were seeing in Italy. There was this absolute determination that the NHS would not collapse under the weight. And what that meant was people maybe were sent to care homes who maybe shouldn't have been, maybe a bit early, or weren't brought in from care homes, who maybe in other times would. Although, of course, not everyone in a care home always should go into hospital. That's another question. So I think we've learned a lot. I think we've got more testing, we've got more tracing. We won't do that again with care homes. And where there are local outbreaks, we'll have the intelligence to get on top of them quicker. So I guess the lessons learned have been put into practice. How well they've been put into practice, I think we're going to have to see. And of course, the other thing is all this is contingent on people's behaviours. If people don't want to comply with the testing, with the tracing, don't want to keep themselves isolated when they should, it could all go up again, whatever anyone does, really. I mean, the powers we have just won't stop that. So I think those are some of the possible things that happened that made it a problem. Some of the lessons learned that have been put into practice. But, you know, as a sort of semi-scientist, I always have to say there's more we don't know than we do. So, you know, anyone who comes up with a perfectly clean story about what went wrong and this and that and the other, and this is what happened, you know, they're over interpreting some things. You know, some of these things are quite complex and will take quite a lot of understanding fully, and we probably won't get that full understanding for a while yet, but certainly we're in a better position now than we were when it started.
Thank you, Bruce. I've got Chris to speak now, then Lisa, and then Hal. So Chris Hounsell, please.
Thank you. Question, Bruce, on testing. There's some doubt as to the reliability of tests and the results that people get back, particularly false negatives, I believe. I was talking to somebody the other day who'd been to Bristol Airport and who was to do a test, who was shocked to find he had to self-administer it and clearly felt he didn't do it properly because he didn't really want to stick his piece of whatever it was right up his nose. Is there any way that when we start, if let's say there's another wave and we have testing again, is it possible that people are tested by somebody who knows what they're doing rather than asking somebody to sit in their car and try and self-test?
Yeah, it's a good question. I must say, I had thought the drive-in centres were not self-administered, so you've taught me something. We are trying, well, there's a mix, there's a mixed system. If it goes to your home, you either do it yourself or you ask someone to, and you're right, it's not very nice. We are trying to train people up in care homes. We will be trying to train health workers. So we want to move as much as we can towards other people administered tests, but the system does rely to some extent on self-testing, and there will be false negatives. There will be false negatives with any test, however well administered. No test is perfect. It's the one we've got. There is work being done on a saliva test. I'm not sure whether that's really in use yet or just experimental. In fact, at Southampton University, we're working on a saliva-based test. So I think there's a recognition that it's not a perfect system. I think we're probably stuck with that being part of the solution for the time being, but that might change over time. And the amount of science that's being done on every element of this, the testing, the vaccine, the antibody testing, it's like a sort of Apollo mission. You know, it's a vast amount of science being done in an incredibly concentrated time because everyone understands the sort of problems you're referring to. So that's a bit of an answer to your question. Yeah.
Thank you.
Would it have helped if I'd unmuted myself when I said all of that?
I guess you are.
Yeah. Lisa, would you like to speak?
Thank you, Dina. Bruce, my understanding is that the testing station up at Odddown is to test whether you've got the virus or not. When do you anticipate the antibody test will be available? Because you said earlier that there was no doubt that additional people had the virus, but weren't on your books. And certainly I'm aware of two people who actually had unusual symptoms, if you like, went into the RUH and got diagnosed with having something else wrong with them. And subsequently, it turned out that they had the virus. So to me, the availability of the antibody tests to encourage as many people as possible to go and get tested would give us a much better idea of where we are as an authority. So when do you think this antibody testing would come in, and do you think it would be a good thing? Thank you.
So another big question, and not a straightforward answer. I think the first thing to say is we don't fully understand two important things. One is, if you have the illness, how many people will get antibodies that are testable anyway? And the more important thing is, we don't fully understand whether those antibodies are useful in terms of immunity. But as you say, whether or not they're useful in terms of immunity, they would give a marker of who's had the infection. But then to turn that around, there's not much point in knowing who's had the infection if you don't know whether it gives you any immunity, because you might just have it again next week, like a cold. You can get a cold several times in the year, can't you? So when will it be out? Well, it's available. At the moment, it's being strictly used in controlled groups. So health workers, to look at transmission in a very high risk group. And I suppose, because if we do discover that the antibodies give immunity, that's the first group you'd like to know who has had it and who hasn't. And then that'll be maybe rolled out to social care workers next. And then there's a kind of random sampling going on in the country as well, to try to get just an epidemiological picture across the country of who's had the illness. I think it will probably be quite a long time before it comes out more widely, because there probably won't be an appetite to put it out more widely until we understand what it means if you have or haven't had it. So I suppose that's the best answer I can give. And if you, the antibody test is also a blood test, so it's not something you just want to give to people willy-nilly, and that, you know, it requires a trained person, it requires a kit, it's painful, you know, it's not something you want to do if you don't have to. So I think it will probably be a little while before we see that rolled out more widely, and that's the best answer I can give at the moment. It's certainly, you know, it's one of the holy grail questions, is what does the antibody mean? And of course that relates also to the vaccine trials. We heard the other day that the Oxford vaccine gives you both antibodies and T-cell immunity, but they still don't know what the quality of that immunity, what the quality of that is in terms of disease immunity. So it's all there. It's interesting times, as they say.
Thank you.
Thank you, Bruce. I'm actually going to ask Alan to come in, because I know he wanted to also respond to the point that Chris made, and then I'm going to go back to the other questioners, so which I think is Hal. I think you're the last questioner at the moment.
Thank you, Dina. All I would say, Chris, I went to the airport to be tested, and I thought it was extremely efficient. They did it to me. I didn't do it for myself. And I left Keynsham at around about 10:10, and I was home again by 11:30. So it's extremely efficient. But that's, you know, I'm not doubting what you say, but nobody suggested, do you want to do it yourself? I don't know why you would want to do it yourself, sticking an enormous cotton bud down your throat and then up your nose, remembering, of course, to turn it around. Yeah.
Perhaps they look at how big your nose is and decide whether you need to do it yourself.
Well, very true.
Okay. Sorry, Hal, you're next on my list.
I was going to talk about mask wearing and wanted your view on that. There was a report from the BBC last week which indicated that we have a rate of 600 deaths per million, and Japan has a rate of 7 per million. And he made the point that mask wearing is universal, all outside and inside. And there was another report that Strasbourg put on the candidates from Johns Hopkins, which showed that if both of you are wearing masks, the chance of infection is 1.5%. If you put those two together, it seems like mask wearing could be a very potent weapon, and yet we don't really seem to be hearing too much about it. And I wondered if you've had any word with the police to encourage them in their role rather than the shop's role to find people who are not wearing masks in shops.
Yeah, it's been a long story, the mask story, and I suppose the outcome of all the discussions is that we are now persuaded that there's use in using masks, more to protect others from yourself if you're secreting than you from others. But on that basis, if everyone's wearing masks, we do expect to see an improvement. Some of that's, you know, it's hard to compare what happens in one country with another on one basis, but it does look like countries where mask wearing is common have had a better experience up till now. The science, it wasn't ever brilliant, but there seems to be enough evidence that it's worth wearing. So I think you're seeing the outcome of that in gradually encouragement and then making it mandatory. I think that the police, it's an issue with the police. I mean, two things in Britain: the police are very wedded, and our society is fairly wedded to a kind of policing by consent. And the police are expecting, you know, a lot of people are expecting them to break up any groups, to challenge anyone who's not wearing a mask. I guess it's like any antisocial behaviour. There aren't very many of them. They can't, you know, they can't flood the streets, and they don't want all the responsibility for people's social behaviour. So I suppose that's where we all come in. I mean, they will if necessary, and if they can be somewhere, but they're not going to, you know, they're not going to respond like it's a 999 call. I think that's a job for all of us to both wear masks, be prepared to challenge people if they're not, and just impose that healthy behaviour by peer pressure. But of course, you have to remember there are a lot of people who can't wear masks for various reasons, respiratory, other reasons. So it's also tricky. You don't want to sort of aggress people who, you know, then have a good reason not to wear a mask. That'll just drive them indoors, won't it? So we'll see. We'll see on Friday, won't we? Friday, we're told we now all have to wear masks in shops, and it'd be interesting to see how compliant people are with that.
Thank you.
Bruce, I know I've asked this question of you before, a similar sort of question. What about those people who need to see another person's lips, you know, those that rely on lip reading?
Yeah, well, public health is a kind of numbers game, really. You know, when you're thinking about public health, when you're thinking about epidemiology and diseases in populations, it's about statistics. It's not about nailing every single individual possible risk. So if you think about the number of people in Baines who have infection at any one time, at the moment it's low. If someone has a special need to not have a mask or to take a mask off to talk to someone, well, do it then. It's not about absolute risk. It's about just minimizing. And if you have to do that, well, maybe stand side to side. Don't be face to face for a long period. You know, think of all the ways transmission happens. Think of all the ways you can minimize it. But I would say that's fine. If you have a reason to do something differently, then do it if you have a proper reason. And if the people that don't have any reason stick to the rules, we'll still see a big impact across the whole of the community and the whole of England.
Thank you very much, Bruce. To see if there's any more questions. So I have Dawn, who I believe would like to speak.
Hello, I was just wondering, is there not, I've heard somewhere, that there is doubt in respect of how the length of time that you may be immune even if you have the antibodies? There's some concern about it, you may only be immune for several weeks or several months. Do you know any more on that?
What I know is that we don't know, and it may not be even at all. I mean, it would be unusual for a virus to give you no immunity for any period of time. And there's questions about if you have a severe illness, are you going to have more antibodies and more T cells and be more immune? And if you have very little symptom or very little illness, does that mean your body won't have needed to produce much in the way of immunity? So it is really the big unknown. And part of obviously lockdown has suppressed infection, but part of the problem then is it's harder to learn, isn't it? If there's not much infection in the community, how do you know if you've had COVID? How do you know if you're immune? No one's got it around you. You won't get the illness. That doesn't necessarily mean anything. So that's why things like the vaccine tests and even some of the other epidemiology, we're studying out in Brazil and out in South Africa. We're relying on their bad luck to be our scientific advantage. So just don't know is the real answer. And when will we? Sooner the better, but I think we probably have to watch it through a year or so before we start to really fathom some of these questions and see what happens when countries come out of lockdown and you get more cases, and you'll start to get a sense of whether people are immune.
Oh, my apologies. I seem to have had a funny moment there. I just disappeared. Right, I was just going to make Dawn the last question on that for now, because we actually have some other questions that we'd like to also pose to you, and to find out, your thoughts on this, because, your thoughts, your experience, your knowledge, I think will also help us in what we do if there's another if we have to have any sort of local lockdown, and also what to do in case there becomes if this becomes a bigger issue nationally as well, and also it'll influence what we do in perhaps the days when there is we're not threatened by this virus, but if there's another type of emergency or another type of virus that is circulating. So my first question I wanted to ask of you is, and this is where I want you to reflect on community support. So it'd be useful to know what you thought worked well and what didn't. Certainly from an outsider's point of view, I think the support that Keynsham particularly put in place, Keynsham and Salford put in place, I think was well recognised, certainly from the perspective of the Compassionate Communities Hub. So it'd be, this is your moment. So tell me what you thought worked well and what you thought didn't work quite so well. So where shall I start? So I've got Lisa to speak now. Is this on this issue? I hope so.
I did want to ask Bruce a further question about visors as opposed to masks, but we'll do that another time. I think the community hub that was existing in Keynsham, it was really about community. It was about the fact that you got dial-a-ride delivering medicines, delivering groceries, but also the phone calls, the distance contact with individuals who are on their own. Because personally, I think that's where the biggest mental health issues arose, where you had people living on their own. And I think certainly our community hub, with the way they went out to identify people, to keep in contact with them so they didn't feel so isolated because there was someone to talk to. I think that was really important.
Mm. Yes, and I think that has been recognised actually from outside of Keynsham. Let me see if there's any. This is always the difficult bit, sort of juggling the chat as well as looking for your hands and virtual hands too. Adrian.
Yeah, I don't quite agree with Lisa, because it was a big community come together. We had over 200 volunteers in Keynsham come forward to support in terms of getting shopping, and then as Lisa rightly said, we can with dial-a-ride, 67 cooking food. So it was a very, very much community group come together. I think what impressed me more than anything was the speed that it was brought together, and that goes down, I think, probably to about 3 or 4 people that did that organisation initially, and then how everything come together, different organisations, the community fridge, community at 67 dial-a-ride and so on, all came together with one purpose, and I think that really, really worked well. I'm looking at Dawn, she may agree or may not agree, but I think we're at a position now where we're very much in that transformation phase, that the phase of between, is tailing off a bit now. We've got an hardcore of people still using the service, but in the main it's tailing off. So it's really, how do we keep things bubbling around underneath, ready to raise its head again if and when we may need it. So we're very much entering a new phase now. And also I think a phase of looking for a new group of people now, the people that feel more freer now to go into the shops under their own steam and get things. But we're going to have a group of people, I think, that's going to be into things like food poverty, for instance, because of redundancies, because of unemployment, all those things that goes with the economic situation that the country is going to find itself in. Those people, I'm afraid, may not be so easy to identify as the ones that we've had in the past, because of, to actually admit you can't put food on the table for your kids is very, very difficult for anybody. So I think the challenge for us is to recognize that new need, and then how do we actually get out to those people and bring them into the service that we can give them.
Thank you. I'm not sure that we're in a position to answer those questions, but I think those are very important questions that we need to take on board, I think, for the future. So the next people on my list are Hal, then Duncan, and then Andy, and then Dawn. So Hal first, please.
I was given a list of about 120 people over 70 to ring. And the thing that struck me as I went round was a large number of people, obviously their children were looking after them. But I think I only managed to get the emergency number out to about 6 people. And what I think was very effective, and we should keep for any future one, was the appointment of those street people. One person was given a postcode or a street, and they'd been out with the paperwork and gone through, and everybody had the numbers very quickly. And as was said, it was the speed with which it happened. Dave Biddleston and his colleagues got themselves organised. But the thing that I would take is, if you've got people in the street going down, doing shopping for people, seeing if they're okay, that was very effective, I think.
So sorry, Hal, I just wanted to confirm something. So this was the street, I forgot what they were called now. There was like street...
Stina, it's Claire. They were called Street Champions from 3SG.
Street Champions, thank you. That was the word I couldn't think of.
That's okay.
But was it Street Champions that had been set up for the Compassionate Communities Hub, or was this a different form of Street Champions that was set up separately?
It was set up by the Community Hub.
Okay, thank you. And I agree, actually. I think this is one of the areas that has been phenomenal, is about that community willingness to help and to really put themselves forward. So I'd like to bring in Duncan now, and then Andy Waite.
Thank you. I spoke to the full council about the response, community response in Salford. I won't go through all of that, just to highlight a few things. Key community representatives and organisations, we met very, very early in Salford, at Salford Hall, mid-March, and coordinated a village response. And within a matter of 48 hours or more, the whole village was leafleted with a single telephone number to contact, and through that they could access all kinds of support and help. And my appreciation, everybody's appreciation in particular, to Chris Essex, the leader of Salford Community Association, and everybody involved with Salford Hub. It worked very well. Salford was split into zones, and there were people allocated to each zone and each street and each task. And it was a marvellously organised operation. And that operation, it has obviously been mothballed for a while. And if there was another rise in infections, another lockdown, it can be resurrected very quickly. The framework is there. Also, there was great emphasis as well on the social side, trying to maintain morale. So we had stay-at-home street parties on VE Day. We had picnics on the lawn on Queen's official birthday, celebration of villagers' special birthdays. People came with cakes and knocked on the door, and they were very much appreciated. We had scarecrow hunts and all sorts. So there was a big effort to try to bring the community together. And can I just say, John Twist is a very modest man in Corston, but Corston did a very, very similar effort led by their community leaders. So appreciation to them. I'm just thinking, yes, the only thing that was a concern was that we couldn't get hold in Salford of lists of the shielded people. The national government, I think, was the problem. They were reluctant to share information because of GDPR and other concerns. And of course, the shielded people were absolutely the people that we wanted to help. So it was very frustrating. We almost had to find, other ways round to try to make sure people didn't slip through the net. And I hope nobody did. But whether Bruce can add anything to that, if we could have the people who maybe were getting letters from their GPs to shield that information made available to the local support hubs. Okay, thank you.
So Bruce, I don't know if you want to pick up on that point. Otherwise, I know that Claire, I think, had experience of this.
Yes, I think Claire might.
Yeah.
I know it was problematic. Any information flows were problematic, but I think Claire was more at the sharp end of that, so she might have some comment.
Yeah, thank you both. Yeah, to agree, I understand fully the level of frustration, and believe you me, for those of us that did have access to the shielding list, not being able to share in that way for that reason was a source of utter frustration as well. It is something that we've fed back on a continual basis. I'm happy to feed back again, but we had several requests for us to share the shielded patient data list, and through NHS protocols, we were told that we weren't able to do that. So it's very hard, it's very frustrating. However, the workarounds are admirable in each of the localities and the village responses that are here, and that's to be celebrated, but it doesn't take away from the fact that actually what it felt like sometimes we were doing was operating in a two-tier system and just constantly trying to reinvent ways, because of course, being compassionate, kind people, nobody wants to slip through the net. And believe you me, there were days and conversations in the Compassionate Community Hub where we were feeling exactly the same level of frustration as each of you. I know it doesn't make it any easier, but it is indeed a shared frustration.
Thank you, Claire. Well, let's hope there's not another outbreak, and that we don't need to then try and find a solution to this. But obviously, it will be something that will be raised again and again and again, because GDPR isn't there, or shouldn't be there, to make everybody's lives difficult. So Andy, see how I led quite neatly into you there, Andy?
As ever, seamless, Dina, as always. Yeah, actually, I haven't got a lot to say because most of the other people have already said it. So I've got about 2 or 3 points I'd like to make. The first one is that I think in Keynsham we're very lucky that there is a community feeling, and a lot of work went on that probably nobody knows about. Next door neighbours, all sorts, and Hal shared some of those names with me, and I gave some of those phone calls to people, and it was really. I'll be honest with you, I approached it with a bit of reluctance because I thought, oh, this is going to be a real struggle, these old people and stuff. But in fact, it wasn't like that at all. It was very uplifting, and people were well managing themselves. Very, very, very rarely was it that people didn't have an idea. I had a few phone calls, and I was, because of the speed of the local community, it was easy to send those people in the right direction. So it was good. But it's that basic community understanding where the strengths of it are. And I want to emphasise 2 organisations which made that possible, which haven't been mentioned so far, and that is the Town Council. the town council immediately went £10,000 at the disposal of the COVID-19 response group that people have already talked about, which meant that people could get PPE and various other things, and it wasn't difficult, you know. It was possible just to let that go through. And the other thing was that because the music festival had been cancelled, they were able to use the financial acumen of the financial director of the music festival, which meant that any donations, any money that came in, the use of the town council money was audited, and it was all very professional, and all that was allowed to happen, which meant that the community where the action was taking place didn't have to worry about all that stuff. You know, they could just get on and do it. And there are, Adrian's already mentioned it, Food Bank, Alan's already mentioned it. We had all these people around, and then we had the street wardens, which was the job of the COVID-19 response group, and they were brilliant, you know. And there are people quite near me who are elderly, and they had their door knocked on, and these people, you know, produced literature for them, and so that's why. And it wasn't an unusual thing for the people of Keynsham to do. I'm not saying Keynsham's marvellous. I'm sure it's exactly the same. Duncan's already talked about Salford, and I'm sure it was just as good, if not better, in Salford and elsewhere. But maybe one of the reasons why we have such a low disease count in the southwest was because we actually care about our communities, and we work for them, and we don't put people at risk. And that's all I want to say, Dina. I hope that's helpful.
Thank you, Andy. And it is just amazing to see how much a community will pull together when it's needed. It is, yeah, I think there's often kind of naysayers who don't believe that it's true, and it is very. I've gone all echoey. I don't know why. I'm sorry about that. Anyway, I will ask someone else to speak then, who hopefully won't have an echo. So I've got Dawn, Alan, and then Heidi. Okay, Dawn first.
Thank you. I hate to be negative, I think it's been so good, but I've just got one concern in respect of the government food parcels that were being delivered. There's 3 particular incidents that I was concerned about. There's one man in Keynsham that was delivered a parcel, 3 parcels in fact, and he had no internet or anywhere communicating to anybody, that he was wealthy enough and he really didn't want the parcels. So every time he got one, he was phoning me and I was collecting them, and they were going elsewhere to food bank or being distributed elsewhere. Another one was a elderly gentleman that went into hospital for a very short stay over a weekend. The gentleman or whoever was delivering the parcels left it on the doorstep, and it was there for the whole of the weekend. When he got back on the Monday, everything was rotten inside because it was one of those really hot days. There was melted cheese, etc., or something in the bottom that had gone mushy. And then only in the last fortnight, I had a very distressed lady who's a vegetarian who had a load of meat products coming in several of the parcels. I don't know how we can resolve this issue, but it's something's not quite right somewhere in respect of the parcels that are being delivered. Thank you.
No, thank you, Dawn. And also, I believe that most of the food parcel delivery has now stopped. I'll ask Dave Dixon actually to confirm that in a moment. But you're right. You know, some of the food parcels that went out were, well, certainly in the early days, were for some people quite inappropriate. But I will ask Dave for some additional commentary.
Yeah, we did have some issues with a number of the food parcels, and some of the literature that went out with them over time tried to address some of those issues. So there was things about vegetarians, things about particular dietary needs and so forth, and the fact that they basically said the wholesaler was doing a government food parcel to a standard design with the different kinds of carbohydrates, proteins and whatever in it, and that was what you got. And basically their argument was, is if you don't eat a particular thing or you're allergic to a particular thing, read all the labeling and try and pass the stuff that you don't need on to somebody else. gradually, as time went on over a number of weeks, they did also start to put in the literature that if you had any issues with the food parcels, for instance, if you couldn't pick them up because they actually were very heavy, if you couldn't pick them up and bring them into your property because the wholesaler wasn't allowed to enter your property to put them in, then you needed to contact your local council. So as time went on, a lot of the difficulties and the issues, the information sheets addressed people back to their local authority to try and sort some of that out. And certainly we were picking up at the height of it dozens and dozens of government food parcels every week. But you're right, there was an issue about, it was incredibly, once you were on that system and you were on that list, it was incredibly difficult to get off it. And delivery drivers were told at the very start, if somebody said, no, I don't want the parcel, to ensure that the parcel was still delivered, because the worry was with some people with Alzheimer's and dementia and so forth, there were some issues where people were refusing the food parcels who actually needed them because they didn't realise. So it was a really complicated issue, and I think at the height of it, we probably had about 2,500 people on the shielding list that were getting a parcel every week, but we didn't get that many returns. So it was about probably about 5% of the returns. So on the most part, over time, it gradually got to work a lot better than it did when it started. When it started, yes, it was complete. It was manic. It was mad. We never thought it was going to work properly, but it just took a while for it to bed down. And I suppose some of that knowledge is very useful because we've gained and retained a lot of that knowledge, so that if we do get a secondary spike in the autumn or the winter, then we know the numbers of people that we're dealing with, and we know where they're shielding, and we know the ones that will need support.
Thank you, Dave. Okay, I've got Alan and then Heidi, and then I'd like to move on to the next question, if that's okay.
Yeah.
So Alan first, where are you? There you are.
Yeah, just to reassure Adrian regarding the potential with those who may be made redundant. We are already anticipating that from the food bank point of view, in the same way that 18 months before universal credit came in, we anticipated that as well. So we are already, our highest user are those who are in the low income but employed group, far more than all of those on benefits with whatever problem they might have at any one time. We have over something like 125 agencies who are working as our professionals on the ground, GPs, church ministers, social workers, health visitors, the bath welfare. So all of that is in place, Adrian. And I mean, we would be suggesting that people can drop the bar a little bit when it comes to deciding whether people are in food crisis, because that's our baseline, if you like. They should be in food crisis, but we are well stocked. We have plenty of good volunteers. We've got the Keynsham Dialer Ride, who are doing a fantastic job doing the deliveries for us. So everything is as ready as possible should that sort of large-scale redundancy factor kick in, and hopefully people will find that. I mean, it's not about charity; it's about the people in Keynsham concerning themselves for those who are less fortunate at that time and giving food, and that's great. And we are the middleman or woman or person, making sure that it gets to those who really need it. Could I just ask one question? I don't know whether it's Claire that would answer it, but ever since I was in Lyons, you try to help people, and people say, "Oh, I can't tell you who's got a problem, can't tell you who you need to help." I couldn't understand then, and I can't understand now. If you know who potentially needs help, why can't we say to that person, there is help out there, can I release your details? And get them to sign a form or whatever is necessary. But, you know, we are complying with the law, but we're actually getting in the way of allowing help to get to them. So can we not find some form of process that allows them to give you permission to release their details, please?
Alan, I won't reiterate what I said before because that's discourteous, but please rest assured I do hear, you know, a range of people's views and frustrations on this. So this is something I can pick up with colleagues. I will pick up again through IG governance, through the council and through the clinical commissioning group that owns the NHS GP shielded patient list. And again, you've asked exactly the right question. Knowing what we've now learned and the barriers and the hurdles that have potentially created, yeah, in protecting our communities in terms of being resilient, isn't it, in preparation for what might come next, is there something else that we can do? So I will further escalate.
And actually, another person who might be able to help with this is obviously local MPs as well, who might be useful in changing legislation so that it is not a hindrance and actually can be a helpful tool. I'll leave that to you, Alan, to take up. Luckily, I didn't hear what you mouthed then. Heidi, it's over to you.
Thank you. Yes, hi. Really, I just want to reiterate that everything that I'm going to say we have done not only in the Keynsham Valley, Salford area, but also in the Somer Valley and Bath area. But that sense of community has really been strong within the Keynsham area. Within the children's centres, we were due to be setting up a food club in February, March time before Corona kicked in. And we had to turn that into emergency food parcel, which was really fortunate because we had most of the things at least starting to be in place, but with Dave Dixon's support and so forth, we were able to mobilise fridges or freezers that we didn't have fully or at the capacity we needed for the volumes that we needed and wanted to get out to local vulnerable families particularly. So we worked with the Compassionate Communities Hub to act as a point of contact for vulnerable families, really under the age of 25, children's centres picking up the under 11s, connecting families picking up the over 11s, to mobilise the food parcels. I think a bit like yourselves, we were very concerned about the potential for duplication. We were working with Food Bank, other very generous organisations locally that were adding to the stuff we were getting through from Fair Share to sort of make up food parcels. But what we decided to do was to work with others where we were able to get the data to come up with a spreadsheet or a database that collated the various food parcels going out from us, from Southside Family Project that many of you will know about, and other targeted services in particular, because we were worried about the duplication and wanting to make sure that there was the biggest reach, but also some concerns, not necessarily in Keynsham, but I'm not saying it didn't happen, where there may have been some cuckooing going on, where families are approached or vulnerable people are approached and their food used for other purposes. So we found that bit useful, but we hadn't and weren't able to use that data anywhere else or share that, and certainly that has been taken to the Food Poverty Steering Group, of which certainly I'm on, Alan I know was there, and a couple of others from on this meeting. So it's really good that some of that is being heard and being taken forward, and look forward to being able to flex some of that. I think the other bit for me was the fact that we've now gone from emergency food parcel deliveries, which we were phoning up families beforehand, taking food out, trying to tailor it according to allergies or vegetarianism, etc. And we're now going into our food club model. But the advantage of that is going to be that if there is a spike or a need to increase on that, that we've built some very strong relationships with other agencies locally that we may not have had before, as strong as we have. So like with Centre 67, with the Bath Rugby Club that are doing some stuff around free school meals over the summer, and also the local schools. So we're picking up a lot of the vulnerable families that we're really worried about that aren't going to have enough food over the summer. Picking up again, I think, on what Alan's saying, it's those children that aren't just on free school meals, it's the others that are perhaps becoming, you know, into the redundancy and outside the other end of the furlough. So for me, yeah, I'm hoping that we will be able to be key partners in flexing as is when is necessary. And we are just now trying to figure out what our next steps are, how we continue to operate and offer services going forward for families in the area in the safest way possible. And yeah, I think that's probably it from me. And to say thank you to Dave, because we've mobilised a lot of frozen foods as well, haven't you, from local, but even Bath-based businesses that were offering frozen foods that we're able to mobilise out to families as well. So thank you.
Yeah, thank you, Heidi, and obviously echo your thanks to people like Dave, who've you know, quite often been out there delivering the parcels themselves. Okay, so I don't have any more comments from people. Just double checking. I've got a comment from Hal though, which says mention the number of people on Keynsham Facebook. I think that's directed to you, Andy. So perhaps you could mention that number and maybe say why that's relevant or important.
Yeah, okay. Well, there's Keynsham uses Facebook a lot. There's the Keynsham Community Group, which has the staggering total of, I think, 7,400 on it. Interesting view. On for about half the people of Keynsham. But the group I think that Hal is talking about is the COVID-19 response group, and that has about 2,800 people. And these are the people in Keynsham who were prepared to volunteer as street wardens, who were prepared to deliver food and so on. So there was a huge reservoir of people who could be called upon to help. And in fact, one or two of them got a bit fed up because they weren't being asked to do things. And if we get to a situation where the volunteers are redundant or are not being used as much as they should, I think that's probably a good place to be, though I admit rather frustrating for the individuals concerned. Thank you, Dina.
That's okay. Right, so now we're going to go on to behaviour. So what can we do to keep behaviours good and levels low in our current position? You know, perhaps Bruce could just outline some of those behaviours that we would expect to see, some of those that are on the back of government and Public Health England's advice. So Bruce.
Well, I think it's just really what we discussed earlier. It's the basic behaviours, distancing where you can, maintaining good hygiene, trying to, you know, avoid prolonged face-to-face contact, and then gatherings where people are just through just couldn't care lessness or alcohol, just ignoring everything, very large gatherings. You know, we saw that rave the other day. I think, you know, it's, for me, it's about basic principles and people applying basic principles. It's not so much about minute rules, is it? The rules express the principles. And I'd be really interested. I know this is difficult. It's not, you know, it's easy to say what should happen, harder to say how we can get it to happen where it isn't. So I'd be very interested to hear other people's views. You know, your people that work in your communities understand people, understand. And the other thing I just suppose I emphasise is we're also in danger of getting into a situation nationally where everyone's looking to sort of blame some other group, whether it's by age or ethnicity or occupation, and we don't want to lose community spiritedness through the way we handle this. So there's a challenge to all of us, a difficult challenge, and I'd like to hear what other people think about the area and what they can do and where they need help. Remembering what I said about the police, they're not able to be everywhere all the time, are they? They're a small part of this, unfortunately.
Thank you. And I think one of the real dangers, of course, is as we, in this area, we've had a low rate, pretty much the whole time, is actually, do we then become complacent? Do we then say, basically become almost believing that it won't happen? It won't happen here. It won't happen to us. So how do we stop this then? There's not Adrian. I can rely on Adrian.
It's because I got the biggest mouth, Dina. That's why. I mean, I think it goes back to what was said earlier on. I mean, the main thing we can do is lead by example, isn't it? I think for all of us in what we go about doing in our daily lives as well, but also what we do within organisations that we work with. I'm involved with Community at 67 and also with Butterflies Haven, who works with kids in that on the autistic spectrum. And we're keen to get back going again, but obviously we're going to be doing it in a safe and responsible manner to make people feel safe when they come into the building. So for us, it's about having proper risk assessments in place, proper practices in place, and really doing all the things that we would expect others to be doing. And I don't think, and I think the challenges was touched on earlier on as well, not being afraid to challenge people in a polite way, and in the right way, when we feel that they're not really playing the game.
Thank you, Adrian. Dawn.
I did bring this up at Parish Liaison the other day, but it would be helpful, I think, that if all town and parish councils that have, sorry, excuse the noise in the background, it's a puppy, that have got play areas could get together and discuss like a best or good practice on how to open and run your play areas. I mean, we instigated spray marking 2-metre distances. We barriered areas off with tape where you could have one-way systems on. We put lots of signage up. The signage is being taken down. The tape has been cut. There's no social distancing, and it's very difficult. I mean, I know in Victoria Park, all their gel hand dispensers, their ones were put in, they have been vandalised or stolen. So I'm wondering whether somehow we could have just a discussion over Zoom and perhaps come together to try and get some sort of plan in place. Because if you've got one town and parish doing one thing and another town becomes aware of it and it's different from what we're doing, they're going to start asking questions, well, so-and-so down the road, we can do this in their playground. There's no sort of set guidance.
And actually, it's always so disappointing when you hear stories such as the hand sanitizers being stolen. It's a bit like the life preservers, the riverside, when they get stolen as well. And then you have to put in mechanisms, don't you, to prevent that, a coded keypad and things like that. So I'm just going to the chat. So Sarah is just suggesting that she facilitates a meeting with the clerks and officers around parks. Does that seem like a good way forward? And obviously, thefts and vandalism is a matter for the police, but picking up on the point that Bruce made as well, they can't be everywhere, and obviously there are a lot of other draws on their time as well. I will raise it though with the Police and Crime Commissioner when I next meet with her. Okay.
Thank you.
So I've got a bit of a discussion going on here about what happens in Japan. I don't know how that will work. I think it's quite an interesting point that you raised, Hal, about that in Japan they don't wear face masks as a rule. But I think the comeback from Adrian is that they bow when they greet as well. So there's some of social. There will clearly be some changes and challenges to social behaviour as well as the pandemic continues. I don't have a puppy, but I appear to have some sort of low-flying aircraft, which I'm sure you can hear at the moment. Right, I'm not seeing anybody else who wants to speak on this item, but I guess, just reflecting on the points that have been made, particularly from Adrian around, you know, we need to model that good behaviour ourselves. And I think that's the message that we need to make sure our communities fully get to. Good behaviour doesn't happen because you get told to do it. It happens because, you know, everybody plays their part. And that's how we'll keep the infection rates low. Okay, so I think somebody else mentioned around the issues about mental health earlier, and that's the question that I want to discuss now. So what can we do to ensure people with mental health issues have the right support? And I know that, so I've been hosting a number of webinars over the past few months, and we had a very interesting one with young people. And actually that was a key concern of young people, was about their mental health and how it had been impacted by lockdown particularly, and the sort of the way that their world had changed and had narrowed so much to becoming virtual. I know, well, as a parent, I spend a lot of time complaining about my son's life on Xbox, but actually in some ways that may be helpful for other young people, because they are able to interact to a certain degree, but they're not out there socializing. They're not out there doing, you know, what young people do, which is often, you know, sometimes, you know, we get upset about that because it appears to be hanging about. So what can we do then to help people with mental health issues? Adrian, are you going to be first, or is somebody going to pip you to the post on this?
I was looking at Lisa actually, because I think Lisa's expertise in that area is much better than mine. So I'm going to invite Lisa in, if I can.
Come on, Lisa. The gauntlet's been laid down for you.
Thank you, Adrian. My question, the comment that I raised was not really about people who have established mental health problems. It was more about the residue effect of, 16, 18 weeks, 20 weeks in lockdown, particularly for those on their own, where they weren't seeing people, they weren't communicating with people. I mean, we've seen new data coming out that said people with dementia or a level of dementia in lockdown, they weren't allowed to see friends, and they deteriorated quite a lot. And I'll freely admit that I found when you're locked down and you're not meant to go out at all, and you're meant, you know, apart from a quick trot around the field, you're right, Dina. The structure of your day, the structure of your week disappears, and you start thinking, what day is it? What am I going to do today? Well, I might do some ironing, or I might read a book or something like that. And I think for a lot of people, they lost their pattern of existence and felt very, very not okay. They felt insecure. They felt puzzled. They felt muddled about what was going on and what was going on to themselves. So I think I will give you an example that I certainly stayed at home, couldn't get an online delivery, used a very small emergency shop, and literally ran out of food, and I plucked up courage at 7:10 in the morning and went along and queued at Waitrose, because they were handling people very, very well. Whereas, well, we won't do comparisons, but they were handling, so I went along there, and I can honestly say that when I came out an hour later, my whole attitude to life had changed. Now, this is not just a feminist, I like shopping thing. It was about the stimulation of seeing things, having to decide on something, and whatever. And so I suppose what I want to highlight is that it's not just about established mental health residents who may have deteriorated because they haven't been able to get to their therapist or whatever, I think that there's still an underlying fear from people of all ages about going out. I mean, I try to go in shop in the high street a couple of times a week, even if it's just buying a card or something, just to give the retailers a bit of support. But I'm fairly comfortable. I'm geared up with my mask, Hal, and my gloves and such like. But I think there are a lot of people who are still very scared about going out. And sorry, no, I haven't got a bad cough. Sorry. And so it's about those people reintroducing them, if you like, into society, because they're still very scared.
And I actually, the point you make about, it's not just those that suffer with dementia, I think, that felt the loss of that pattern of existence. I think that was a wide, range of people, as I said, everybody from young people through to, older people as well. And I think the point as well you make about the stimulation of others and things and decision making, I think actually that's a really interesting point. And I guess for some people, if they've then had food parcels that have come to them, then they're not having to take any sort of ownership of their lives, and possibly their situation will deteriorate. And I don't know, Bruce, if this is something that's already crossed your radar at all.
We're doing across the region, actually, there's work going on quite widely about the many mental health problems of COVID in different age groups, including older people. And certainly there's fairly dramatic reports of older people isolating, and especially if they have early any dementia, really suffering and a lot of stress, but also young people. So yes, it's on our radar. I mean, what we do about it, I think some of the things that Lisa was talking about, and Connect 5 ways to wellbeing and so on. But it's a big challenge, especially since some of the changes, are going to be very long term. Probably we're not going to go back to a completely normal situation. I mean, just looking at some of the guidance on opening up of care homes that just came out today, it's by no means going to be a free for all. So yeah, it's on our map, and it's a huge challenge.
And there's two bits of advice that are on the chat. So Bath Mind, who I'm sure many will know, have been operating from the Compassionate Community Hub. They deliver a service 7 days a week called Breathing Spaces. So there's a website there, but there's also a telephone number and an email address. And I think that that will be circulated to all on this call after the call. And Heidi has put out that they are working with Creativity Works in the Bath College. So I'm running a virtual arts-based program for new parents with low mood and depression. And that's through the Bright Start Children's Centres. So again, can I ask that information is also circulated, because I'm sure that will be very useful to pass on to people in your areas. So Brian, actually, no, I will bring you in one moment, Brian. I'm just going to add one more thing, two more things, sorry, that are being put forward. So there's play packs and nature packs for children and families. Obviously, those could be used for older generations. And the Wellbeing College has a number of virtual courses. And again, that website will circulate after this meeting. And so, Brian, let me find you so I can look at you as you speak.
Right.
Hello, Brian.
With my experience with diary is we have a certain number of people on our books, and they have got used to living at home, isolating, and they're using the diary to do their shopping still. But we have a certain number of people who ring literally twice a week, 3 times a week, just to talk to someone. And I think just talking to someone does sort of ease the burden. And the Keynsham Corona group have got the curate down at St John's has been operating a wellbeing service, a listening service, and the trouble is that it's been so long that people have accepted the way of life of not going out, because the lucky ones have got a garden, but I feel that the ones that haven't got a garden, they're the ones that deteriorate, because they've got the four walls and that's it. And we need to sort of produce a friendship system on the telephone where you ring a number of people every week and they ring a number of people, so that you've got this sort of conversation with someone else outside your own environment. Does that make sense to you?
Yes, it does, Brian. And I think it's very, I think it is very sort of sad, really, that there are so many people who are isolated, but it is also quite positive to hear of the work, not only of charities that has been mentioned before, but also of churches as well. And I guess, this isn't a new problem. Obviously, Esther Ransom some time ago set up, I've forgotten what it was actually called, but a similar service for older people, who were isolated, and some people who people might not have expected would be feeling lonely. Claire, I know you've got to go to a meeting now, but is there anything else you'd like to add before you go?
Thank you, Dina. No, I can see that colleagues have very helpfully pulled up about Southmind and about the breathing space activity. I know when we were on the forum call last night, Dave Dixon very eloquently spoke, which I'm sure he will again, about the no wrong door. It's just to remind people that the Compassionate Community Hub does have Southmind as a full partner. So ongoing signposting and support. Please do still encourage anybody that comes to you that you have access to through your community groups that would benefit from having a level of mental health intervention and support. Please do still use the hub number. We are still fully staffed and we have all the pods in operation, and we can, through other support organisations, support you in your endeavours to give additional wraparound care and support. So I think it's just a plea to say, yes, I know we're on the tail end and we're moving into a new phase, but the CCH is still fully staffed to keep on delivering this sort of level of support and guidance to everybody in our community.
Thank you, Claire. And enjoy your next meeting. Dave, is there anything else you'd like to add to what Claire said?
Yeah, I only just to say, yeah, I mean, there's a video that we made about the Compassionate Communities Hub called No Wrong Door, and it's echoing back to a point that Alan made some time ago, which was about signposting people. The food poverty element is the one that gets people through that door. There isn't enough food in the family to feed the family, but often some of these people are quite complex, and there's a host of other issues as well. And what we've been doing when we've been out doing the emergency food parcels is if we pick up on some of those things, which may be to do with debt, it may be to do with mental health. We've said to people, look, we've got the Compassionate Communities Hub, we've got the professionals that are able to deal with all these other different issues. Are you happy that we just forward your name, and your name will then go to those other organisations? Because the real crux of the hub is it's allowed us to have very detailed but sensitive conversations about quite complex people to try and address some of their issues and pick them apart a little bit. Because now the ones that we're getting now and the food deliveries that we're doing now, they are some of the more complex people in our society. And unfortunately, the mental health side of things is often one of those things that's underlying a lot of the issues. And until we can try and deal with some of those, we're always being reactive instead of proactive.
Thank you, Dave. Just seeing if anybody's got their hand up, or if anybody wants to make a. Okay. Yes, Heidi, and that actually is a really good point around IT and that connectivity. And I think we've well, certainly some of us who've been on quite a lot of Zoom calls will have found that sometimes IT is not your friend, and it, you know, you can end up spending more time trying to get onto the call or access the website or whatever than it is helpful. And I suspect that probably does put off a lot of people, and that's rather assuming that you've got access to the internet anywhere. And we know there's lots of areas still in Bath and North East Somerset that don't have that connectivity. I know there's a variety of programs that have been announced, some of which are government led, some of which are through the council. But I would say if there are areas that you are aware of that might be that we might be able to do something about getting that area connected, then let us know, and we can see what can be done to address that issue. So thank you, Heidi. That's a really good point for bringing up. Lisa, you had a question, I think, about leisure centres.
You might be able to answer it, Dina, and certainly the leisure centres have been closed, and although walking is all very well, it does not provide all way round exercise, particularly for those who need to have a trainer. I mean, my son, for instance, has a personal trainer every week. He's only got partial mobility, and his physical well-being, although emotionally he's been absolutely brilliant, he can't wait to get back to the gym, and I can't wait to get him back to the gym with his trainer in order to start picking up and exercising those muscles. I think the other factor is swimming, which for many people who don't do the gym, swimming is the other exercise that all types and fitness levels of people can do. So is there any news about when certainly Bath is opening and later leisure, Keynsham is going to be opening?
I don't know offhand, Lisa. I know that there has been announcements by government about leisure centres and swimming pools, but I will come back to you with some more solid information. Obviously, I'm sure you will be aware that leisure providers across the country are in real grave difficulties. I know some have already handed back their keys to councils if they were sort of operating under a council. It's not something that we sorry, let's rephrase that. What we are looking to do is to prevent that happening, but you know, obviously a leisure centre is an expensive thing to operate, and we are still waiting to hear if government are going to give any more support. We know they've offered council support if they are running the leisure centre themselves, but as many actually use a sort of an intermediary, have another operator running the centres, you know, many councils across the country are suffering huge potential losses if they have to pick this up. So there's sort of two parts to that. I'll see what the plans are right at this moment in time, but also, you know, bear in mind that there is this other element that we're hoping to have some news about quite soon. So thank you
very much, Dina. I really appreciate that.
Okay, right. Any more questions on this? Right, that's great. Now then, I think we've covered quite a lot of the next question, which is about responding if cases start to creep up again. So what I'm going to do is I'm going to leave that for now and actually move on to support for our local businesses to get those up and running safely and to encourage people to shop more locally. Obviously, Lisa, I think, was setting a pretty good example when she said that she goes out and uses them for her, you know, to get her bits and pieces. And I wondered if there was more that could be done. Obviously, the council's got some thoughts on this already, but you might also have some ideas about what else we could do to get that support. Because I think many of these businesses have been, you know, there for everybody, you know, maybe making up food parcels to those that couldn't get there themselves, offering a service that, you know, didn't exist beforehand, I also know that some farm shops also have done similar pieces of work. And I think one of the things that's been quite surprising is some of these local shops have sort of helped dispel the myth that they're more expensive than going to the supermarket as well. So, you know, how do we repay their support to us? And how do we make, you know, how do we get the communities to carry on with that support? Chris.
Unmute. My reason for joining this evening is because I'm on the committee for the Salford Business Network. And I think we need to consider businesses more widely, not just the retailers that are the obvious ones, and also not to assume that all retailers are struggling, although many are. What we found in Salford, although it's a much smaller group, but we've got some businesses who are actually more busy than they've ever been, particularly anyone dealing with IT services and the financial sector. We've also seen some amazing work done by, say, for example, Newton Farm, who have they've reinvented their business 2 or 3 times over, and to keep going. They've found the money that it may or may not be available from local and national government helpful, but they've also had to spend hours and hours trawling through information about who gets what grants. And with any of the businesses that are now reopening to the public, have found the, you know, again, vast amount of information about, you know, how you must arrange your business to be secure has been quite a challenge because it changes from week to week. However, I mean, what we've found is that businesses on the whole have worked very, very, very hard to keep going. There are going to be people that don't get on. I mean, there's one particular person that we're aware of who runs marketing for other businesses, and her work has completely stopped. And she's just one person in a business, and you know, whatever she gets from the government is not going to be enough. So we're going to have a real mixed picture on businesses. There's you know, some doing very well, some fighting to keep afloat, and some that won't cope at all. I think those businesses on the high street have done an amazing job making themselves approachable. I've had people say to me, oh, I go to X supermarket now because when I went to Y, people were all over the place. They weren't respecting one another's space, so I won't go there again. So I think there's a message to retailers and others who work face to face that actually people out there are taking notice of how cautious they are, and they're likely to use businesses who are actually seeming to support people who want to continue to be safe. I volunteer once a week in the Salford Post Office, and people have been, I think we've only had 2 people through the whole time when we've been open who've been difficult. Everybody else has been very helpful, even when they've had to queue outside in the rain. And there's been a sensible response. So I think that, I know we've been in touch as a business network with people in Baines who are working on, you know, helping the high street to reopen. But I do think it's a very mixed picture on business, with some doing very well. We've also had a gentleman who's recently looking to join us. He's an airline pilot. He thinks he'll never fly a plane, you know, for money again, or at least not for years. And he's starting up a business with website management. So there's, it's a bit like the last time there was a financial crisis. Business does change as a result. And what we've tried to do as a business network is just to be there, do some Zoom meetings, you know, to give people a chance to talk about what they're doing, what works for them, and pick up some ideas from one another. I'm sure Keynsham's got a similar arrangement with their Chamber of Commerce, or what have they got at the moment. But yeah, business isn't very straightforward, but I think they're trying very hard. And quite often the smaller businesses, family run, quicker on their feet, and seem to be coping as well as they possibly can.
So it's about adaptability, isn't it?
Absolutely.
But also, it's about that support that we can give. So if we're, making sure our messages are nice and simple and easy to, so any information or guidance that we have has to be easy to access. But I think the point you make about not all retail and all businesses, they're not all struggling, I think is something that we do need to bear in mind. So thank you, Chris, for sharing all of that. Is there anything else that people want to talk about on that item? Okay, so as I said, the council is putting together some ideas about how certainly the high street can be more supported. So obviously when that's ready, I'm very happy to contact you, and we can see whether you want to use those sorts of materials that will be available or not.
Yeah,
Nobody will
we've made contact with is it Rob and so on at Baines, who are working on that initiative, so that'll be helpful.
Okay, that's lovely. Well, we'll obviously announce that more officially in due course. So, okay, so that's that. Then the last question is, what can we do to respond quickly and decisively if there are localised outbreaks in specific neighbourhoods or population groups? In some ways, I feel this actually gives you the answer as well. It's a sort of question I think you'd all like to have in a test, isn't it? Which is, what should you do? You should respond quickly and decisively. But perhaps what we could also ask at this point is, what would you like to see in that response? Obviously, one of the things that we have been talking about is where people go to get that information. So we can give people advice about where to go, and obviously make sure that we get that information out there. So we've spoken before in other, in the parish liaison meetings and other forum meetings about the sorts of tools that we can use, such as local radio, also obviously the TV, and local print media, often known as newspapers, I suppose. But is there anything else? Are we missing any other avenues that we can utilise? Perhaps I've brilliantly covered everything that could be possible. Okay, Brian. Brian, you need to unmute.
Thank you. Is there any place on the Baines website that tells you where we have a case of coronavirus? Because last week there was a panic in Keynsham amongst the older people because they were told there was a case of COVID-19 in St Cana Court, and everybody was running around like headless chicken. Is there anywhere that defines not the person but the area where there is a COVID case?
I think this is definitely a Bruce question. So Bruce.
We're not putting out yet details of where people have the virus. What will happen is, if there is one in a home or anywhere where there are people at risk, Public Health England will contact that home, will put measures in place. There's possibility that very detailed information will be put into the public domain. We really don't want to do that, but we want to reassure people that contacts will be traced of individuals, and if there's any increase in cases in an area, we will let you know, and we will ask you to put information out to help people know that they're at higher risk. That's part of the quick response, is getting information out at street level. Had there have been a case in Cana Court, you can be quite sure PHE and us would have been on it like a rash, as it were, because that's exactly the sort of situation where there's possibility of a big outbreak. But no, I mean, I do get sometimes asked, can I tell people exactly, you know, where things are, and we don't want to go down that route. It's not really helpful, actually. What are you going to do, you know, if there was that panic? Is everyone going to leave Keynsham? Are they going to, you know, put a wall up around the chocolate quarter? You know, there's certain things that could happen that we wouldn't want to happen.
The only reason I asked the question was because one of our drivers actually went in there before the authorities went in, and they had to have a test which was negative. Now, if you have a test when you've only been in contact that day, surely it's not, the test won't be able to be valid because the coronavirus is not being.
I don't know the circumstances in which no one would have a test, you know, at the moment they've been exposed. That wouldn't tell you anything. I don't know the circumstances of what you're referring to, so I can't really answer the question on it, I'm afraid.
Our people are on the front line all the time, and it would be nice to know if there was a case, so that we could take measures to either avoid it or cancel a trip or do the right thing. That was all.
Yeah, it's a valid question. It's a tricky point. How much do you put out, and how much do you just deal with things through a risk approach? So there is certainly there's both a demand and a caution about the degree of information that gets put out. So I think that's the answer I'd give for now. But certainly care homes and schools are the two areas where we absolutely, you know, firstly the biggest number in any place of high, you know, of high potential for an outbreak. So we will take very seriously any case in a care home, and it will always become a special case that the Public Health England regional office will look at with us.
Okay, thank you very much.
And I would add to that, Brian, that if I would just say to anybody that's going into an area where there is likely to be risk, you know, just to make sure that everybody assumes that there is a risk and takes, you know, the necessary precautions, make sure they've got their masks, they've got their gloves on, they've got hand sanitizer, you know, all those normal, it's a bit bizarre actually saying all those normal precautions that we now expect. Lisa, I think you wanted to speak.
Yes, in answer to your question, in terms of how do we get out there, I think it goes without saying that the towns and parish councils should be contacted immediately, as well as, of course, the ward councillors. I mean, certainly, Alan and I are part of social media sites, Facebook sites, in a number of estate areas, as well as having our own website. And certainly, Brian, I know, is a member of the Summerdale Facebook. So I think Heidi mentioned it, that social media now is such a quick way of getting information out. But the important thing is, as referenced by Brian's example, it needs to go out so it's got credibility, because it can't go out as, well, the rumour is. So I think that we if it goes through the town and parish councils, and perhaps they are, I know that they are linked into a lot of these estate sites and the community hub and whatever. So they have a quick list, and Dawn, perhaps you could update us in terms of Keynsham Town Council, but they have a list of social media websites, Facebook websites, Facebook pages, sorry, it's been a long day, so that we can get the message out very quickly.
Thank you. And thank you, yes, both to Lisa and for Heidi for reminding me about social media. Yes, I'm aware of social media. Okay, right. So is there anybody else that wants to raise a point on any of those questions, or particularly that last one? If not, then can I say thank you very much to everything that you've said, for your insights, and but also for the work that you as communities have done during the heat of the pandemic. I mean, we're by no means over the pandemic yet, but also thank you for what you continue to do. and for the work that you'll be doing to support your communities in the future as well. So it is really, really appreciated. I think at this point, Alan, I'd like to hand back to you. If there's anything you wanted to add to the sort of the end of your meeting.
Well,
so over to you, Alan.
Yeah. Big thank you to your good self and Bruce for being our guests, as it were, this evening. Always nice to see you. A big thank you to those who have participated this evening, and it has been a very positive and full participation, which is good. We'd also like to hear from you about future meetings, folks. When we meet in the place in Keynsham, we don't have too bad an attendance, but there's more than they're here tonight. So if you can spread the word, that would be very good. I'm told there's a provisional date for a future meeting on the 16th of September. Now, some of you might feel that we need to meet earlier. So please contact Sarah if you feel that, and any suggestions about what you'd like to discuss. And the council is also doing a series of webinars, and I'm sure Dina would be interested to hear from you if you have any suggestions for future topics. We want to ensure that we continue with our engagement, both between ourselves and the community. It's a lot of people have worked really hard to build this up, and if there are ways in which we can do this without physically meeting, then clearly let us know. I don't think there are too many alternatives. It's this or physically meeting, but you know, it may well be that towards the 16th of September we may well be able to physically meet, but well spaced, if there aren't too many more than are here tonight. So a big thank you to you. Just to reassure Dina, the email has already gone to Jacob, asking him to do what he can to change legislation in relation to GDPR so that people can share details of those people who need help from a whole host of agencies. So who knows, but obviously don't hold your breath that will happen within a month or two. So just a big thank you again for joining us. Have a safe journey downstairs into the next room or wherever you're going. And hopefully we'll see you in a couple of months. Thank you.
Thank you, Alan, and everyone. Good night.
Thank you.
Bye.
Bye.
Bye.